Good morning, everyone. Today I am presenting the seminar on the topic corneal topography. So, as we know, the normal cornea is a prolate shape. It is steeper in the center and flat at the periphery. Anterior surface of the cornea is elliptical, and posterior surface of the cornea is circular. And the diameter of the posterior surface is 11.5 mm. As we know, the anterior surface of the cornea is elliptical, so the horizontal diameter is 11.7 mm. That is, this diameter is 11.7 mm, and this vertical diameter, this is 11 mm. If we look for the thickness of the cornea, then in the center it is 0.52 mm, that is 520 micron, and at the periphery it is 0.67 mm, that is 670 micron. The anterior radius of curvature is 7.8 mm, and the posterior radius of curvature is 6.5 mm. So if we look at the zones of the cornea, so the central zone of the cornea, it is approximately 4 mm in diameter, and paracentral zone, it is 4.8 mm. This peripheral zone is 8 to 11 mm. It is the zone where the normal cornea flattens the most and becomes aspheric. And this last is the limbal zone. Then, now what is corneal topography? It is a non-contact imaging technique that maps the curvature and shape of the cornea, and especially the anterior corneal surface. It creates a color-coded map that shows how steep or flat the different areas of the cornea are. So if we look at the color coded diagram, the color coding indicate that if there is dark blue or blue color, that represents that flatter area, that is 34 to 40 diopter. Green represents normal curvature, 41 to 45 diopter. Yellow or orange represents steeper areas, that indicates higher curvature, and the range is 46 to 49 diopter. And if we look at red, it shows very steep region, often seen in the case of keratoconus or ectasias, and the curvature is more than 50 diopter. So this is the color coded diagram, color coding for the corneal topography. As we see, this is green color, this is nearly greenish or yellow color. This part is yellow, this orange, red, this red. Red color shows the steepness. Then the principle. What is the principle in which corneal topography act? The corneal topography is based on the Placido disk reflection. The example is Atlas. There are series of concentric illuminated rings that are projected onto the cornea. And as we know, our cornea acts as a convex mirror, so these rings reflects back. The distance between the reflected rings changes depending on the corneal curvature. If these are closer to each other, that represents the steeper surface. And if there is farther rings, there is distance between the two rings, that represents the surface is flatter. So this is the principle for the corneal topography. If we look at the indications of the corneal topography, so it assesses the corneal curvature and refractive power distribution. It detects the corneal irregularities. So what are the corneal irregularities that it can detect? Like keratoconus, post-LASIK surgeries. In the surface irregularities, it can detect the epithelial defect, tear film instability. If there is any corneal scars, corneal edema, ectasias, it can detect these corneal irregularities. It can diagnose ectatic disorders like keratoconus. We can plan for the refractive surgeries like LASIK surgeries, PRK surgeries. We can evaluate post-surgical corneas after keratoplasty, cataract, or LASIK surgery. And we can use the corneal topography to monitor the progression of diseases like keratoconus. And it can also use to evaluate the astigmatism, its type, axis, regularity. So these are the indications for doing the corneal topography. If we look for the prerequisites that are needed to do this imaging technique, that we should avoid all eye drops, particularly the local anesthetics, as they decrease the TBUT. So we should stop contact lens use before testing. If the person is using soft lenses, it should be stopped 1 to 2 weeks before, and if rigid lenses, then 3 to 4 weeks before. There should be no foreign body, mucus, any active infection, epithelial defect. The ocular surface should be clean. The patient should have a stable fixation. There should have a correct head positioning. And other any contact procedures on cornea like tonometry, A scan, these should be done after doing the topography. So in this we can look, there are corneal topographic patterns. So depending on the corneal curvature, we have regular patterns, astigmatic patterns, and irregular patterns. So if you look at the regular patterns, this one is round, and the round that shows it is centrally symmetrical. If we look at oval, it could be slightly vertical हो सकता है या फिर horizontal elongation हो सकता है. In the steepening, there is superior steepening or inferior steepening. And this one is irregular pattern. If we look for the astigmatic patterns, there are symmetrical and asymmetrical patterns. Symmetrical patterns may we have bow tie pattern, like this one, symmetric bow tie pattern, with or without skewed radial axis. This one is with skewing. Skewing means the two hemimeridians they differ by more than 21 degree. ठीक है. और this with asymmetrical में we have in superior steepening and inferior steepening. There are bow tie with skewed radial axis. This one is asymmetric bow tie with inferior steepening. This one is asymmetric bow tie with superior steepening. This is asymmetric bow tie with skewed radial axis. So these are all the corner topographic patterns. Then if we look at the topography maps, so there are 12 topography maps that we are going to study. One is axial curvature, tangential curvature, elevation maps, mean curvature, refractive power, irregularity, corneal wavefront rings image, keratometry, image simulation, PSF, MTF. These are the maps that we are going to study further. So first one we are going to talk about is axial curvature. So firstly, we should look for the terminologies which are given on the topography machine. Like what is the meaning of this OD? OD means oculus texture, that represents the right eye. Then the date is written when the test is done, the timing of the topographic machine test. So all this is given. In this side, if we see, then there is written that expanded colors custom scale. There's a scale given, and each column represents 1.5 diopter. That is 31, 34, 37, and there's two column difference. So each represent 1.5 diopter. So if we look at this map, this cross X represents steepest cornea. This cross X with the circle, it represents that the visual axis or the line of sight. This triangle, it represents the pupil center, and these all should be in the same line. If these are decentered, like this one is here and this one is here, it represents that there's some corneal curvature irregularity. There could be some ectatic disorders due to which this this is decentered. And this axial curvature map, it tells about the curvature in reference to the visual axis, and it is the most common map which we are used for interpretation of the corneal topography. But the limitation of this axial curvature map is it is poor in detecting any localized abnormality. For that, we have to go for tangential curvature map. In this, we look that there are grid lines. These grid lines indicate? These grid lines indicate the angular degrees, that is 0 to 360 degree, and it also helps to locate the specific regions of the cornea. So as we have already seen, the relative position between these 2 points, this triangle and this cross with the circle, these indicate the centration, and if there is decentration, which is common in mild irregularities or early ectatic changes. Then if we look at this part, so here it is written that flat K, steep K. What that means? Flat K, it represents the flatter cornea. Flat cornea means it represents the two meridians, flat K and steep K. Then we have astigmatism. Astigmatism is the difference between this flat and the steeper curvature. Then we have eccentricity. What it describes? It describes how much the cornea flattens from the center to the periphery. it is a measure of asphericity, and the normal range is 0.4 to 0.7, and if the range goes above, that is more than 0.8, it represents that the cornea becomes more aspheric, and possibly it could be a case of keratoconus. Then we have shape factor and Q value. Shape factor, it also represents the measure of asphericity. The normal range is minus 0.10 to minus 0.50, and in the Q value, if the value is negative, that represents the cornea is steeper in center, that is prolate, and if it is positive, that is flatter in the center or oblate. And if Q value is less than 0.8, that represents that highly prolate, that is keratoconus, and if it is 0, more than 0, that it represents post-LASIK flattening or keratoplasty. Then it is written here that HVID means horizontal visible iris diameter. That is normal range is 11 to 12.5 mm, and it helps in selecting the contact lens diameter. If it is less than 10.5 mm, that represents that it is microcornea, and if it is more than 13 mm, it represents it is megalocornea. Now the next is tangential curvature. As we have already seen, it tells about the localized curvatural changes, and it is more sensitive to detect the localized irregularities. So steep K, flat K, astigmatism, shape factor, all we have seen before. So the new terminologies we are going to learn is CIM and TKM. So the full form for the CIM is corneal irregularity measurement. It tells about how smooth or irregular the corneal surface is. The normal range for this is less than 1 micron, which is normal, and if it is 1 to 1.5 micron, that represents the borderline, and if it goes above 1.5 micron, that is abnormal. The next terminology is TKM. TKM, what is TKM? TKM is total keratometric mean, and it is the average of steep K and the flat K. And the normal range for this is 42 to 45 diopter, which we have seen in varies with the population. The next map is elevation map. So elevation map में what it tells about how high or low each point on the cornea compared to the reference sphere. So the reference we are going to take for comparison of this map is a sphere. It represents that the cornea is a sphere, and any point above or below represents the asphericity. So areas above the sphere will be steep areas and below is flat areas. So in this map we can see there is written fit zone, fit type, fit R, fit D. So fit type we have already know that we have taken it as sphere. Fit type is sphere, which is a reference surface used to study. It indicates that the corneal data is fitted to be a best spherical surface, and other spheres could be toric, ellipsoid, aspheric, etc. Fit zone 10.1 mm, what it represents? It represents that it is the diameter of the analyzed corneal area, the corneal area over which curvature or elevation we are going to study or calculate. Then we have fit R and fit D. Fit R meaning of R is radius of curvature of the best fit sphere, and smaller the radius, it indicates steeper the cornea. And then we have fit D. Fit D is dioptric power. It has a formula. The dioptric power is equal to 337.5 upon R. From this, we can calculate the refractive power of the cornea. If we have if we have to calculate the dioptric power from the radius of curvature, we can use this formula. Dioptric power is equal to 337.5 upon radius of curvature. So the next map is keratometry. What it measures the curvature of the cornea, and it is used to assess the corneal shape and the astigmatism. In this also we can see there are some blue lines and the red lines. As we have already seen from the color coding, that blue represents the flatter areas, the flatter curvature, and the red represents the steeper areas or the steeper curvature. So the same is given for this part. And these lines, this represents also the degree. Like This one central part we have seen there is 46.33 diameter at the rate 290 degrees pay, it is 46.33. So all this represents the degrees of the curvature. Next is irregularity map. What it indicates, it quantifies the minute variations in the corneal curvature within any specific central zone. If we look for the central zone, which is 3 mm area, if there is any irregularity in this zone, it will reflect the visual axis, and there will be that will affect the best corrected visual acuity of the patient. Then we have 5 mm zone irregularity. Then 5 mm zone irregularity. If there is any irregularity in a 5 mm zone, then it reflects the overall corneal shape. So any high value will represent more global irregularity, more commonly seen in ectasias. So in this, the fit type we are going to take for this is quadratic surface fit, quadratic surface. Why we are taking quadratic surface for this, and earlier we have taken sphere surface fit? Because the surface used to represent the cornea is more accurate than a sphere. If we take quadratic surface, it is more accurate than the sphere we have taken before. It can more precisely tell about the irregularities and useful for detecting any subtle asymmetries. The fit zone 10.1 mm is the corneal area we are going to analyze. R1 upon R2, these are the radii of curvature in two meridians of the flat and steep meridians. The D1 and D2, it is equivalent to the dioptric powers to R1 and R2. Flat meridian, that is 6 degree, the axis of the flatter corneal meridian, it indicates the orientation of the flat meridian on the cornea. Then we have SF1, SF2, that is shape factor or surface fit, describes the sphericity of the corneal surface in the two meridians. So we have seen this, these are, we talk all of this in two meridians, steep and the flat one. Next is refractive power map. Refractive power map, it represents the curvature and refractive strength of the cornea. So all these parameters we have already seen. The new one is index. What is index? Index is the refractive index of the cornea, and which is normal is 1.3760 is normal refractive index of the cornea. Next is mean curvature map. It represents the average curvature at each point of the corneal surface. Next is rings image. Rings image, as we have already seen, the Placido disc based system, which is the principle of the corneal topography we are using to study the concentric rings around across the corneal surface are reflections of the Placido disc projected onto the eye. The shape and spacing reveal the corneal curvature. If these are tightly packed, that will show how steep the curvature is, and if these are wider, it corresponds to the flat areas. Next is corneal wavefront. It is based on the optical clarity of the cornea by measuring the higher order aberrations. Higher order aberrations are complex optical imperfections, and these are not corrected by glasses or routine contact lenses. In higher order aberrations, we have comma, spherical aberration, trefoil, secondary astigmatism. These are the higher order aberrations. In this, we see aperture. Aperture, it is the diameter of the area we are going to analyze. Then order. Order 7, what it represents? It represents the Jernicke polynomials up to the 7th order that includes the higher order aberrations. As we have seen earlier, in lower order aberrations, the order is 1 and 2. For comma and trefoil, it is 3. And for spherical aberrations, it is 4. Index, it is 1.3760. That is the refractive index of the cornea. Then we have SC weight. SC weight means spherical correction. It indicates whether any spherical correction is applied or not. So in this, we have not used any spherical correction. So no is written here. Coefficient edit, any manual coefficient editing we have done or not. So there is no coefficient editing done. So no is written here. Shape factor. is 0.31, it represents the asphericity of the cornea, and if the value is less than 1, it indicates that it is a prolate shape that is steeper in the center. And pupillary diameter during measurement, a larger pupil may increase higher order aberrations. Then the next is PSF. The full form for the PSF is point source function, and it is the image of a single point of light as it appears after passing through the cornea. It should appear as a small round bright spot. Normal or ideal is compact circular bright. If it is elongated or asymmetric, that represents the coma or astigmatism, and if it is scattered or blurred, it will denote higher order aberrations. One arc minute is 1 by 60 degree, and this is 20 arc minute is normal, and if it is more than 20 arc minute, then it represents that there are some irregular corneal surface or higher order aberrations. Then the next is image simulation. It tells about how the patient perceives the image in Snellen's chart, even if their visual acuity seems to be acceptable. It represents how a point spread function from the corneal optics distorts visual images. If greater the blurring and streaking, the more corneal aberrations are present. If the letters appears smeared in one direction, it indicates coma or astigmatism, and if the letters are uniformly blurred, it suggests spherical aberrations. Next is MTF. MTF, it stands for modulation transfer function, and it describes how contrast for different spatial frequencies is transmitted by an optical system. So if MTF is equal to 1 or 100%, it is perfect optical system. And if there is any aberrations or diffraction, then there will be MTF curve will fall off. Thank you.